name is Dr. Terry D. My name is Dr. Terry Deaver, and I'm the Vice Chair of the Odessa College Board of Trustees and serve as Chair of the Education Committee for the Community College Association of Texas Trustees, also known as CCATT. CCATT strives to be the collective force representing the community college trustees and regents in Texas with the mission to foster student success and ensure excellence in governance. Thank you for joining us this afternoon for our webinar titled From Dashboards to Decisions, Strengthening Trustee Oversight for Student Success Outcomes. We are pleased to welcome Dr. Martha Ellis, CCATT's Senior Consultant on Data Governance, Informed Governance, and Senior Fellow for the College Excellence Program at the Aspen Institute. Dr. Ellis is a former college president, a longtime mentor to community college leaders, and a trusted advisor to boards across the country, bringing rich experience in facilitating annual board retreats. Dr. Ellis also is the author of the Data-Informed Governance Decision-Making Framework for Community College Boards, which we refer to as DIG Framework. This framework serves as the foundation for CCATT's Data-Informed Governance modules, a free asynchronous learning series with videos and discussion guides available on the CCATT website. Today's webinar will offer a preview of modules 1 and 2, focusing on how boards define clear objectives and ask stronger data questions in support of student success. We are grateful to Dr. Ellis for her continued leadership to helping community college strengthen board-level decision-making. Thank you for being with us this afternoon. The floor is yours.
Thank you, Dr. Deaver. Trustees and CEOs that are with us today, it's wonderful to see you. It's great to be with you as we discuss a framework to empower you and your trustees in partnership with your CEO to use data to navigate change. Why this matters and why this matters now. As we go to the first slide, we really explore what the board does. You as a board understand the data at your institution. You do this because you want to know more about your students and how they're progressing, to understand your community, your faculty, staff, your local business needs, and of course, performance-based funding. Data includes both statistics and also student, faculty, staff, community, business leaders' voices. Using the understanding of that data allows you to make informed decisions about policy, finance, and advocacy to advance the college's vision and meet the needs of your students and the communities across your service area. You use the understanding of that data to inform the strategic plan, annual goals, and of course, the future direction of the college in partnership with your CEO. The next slide actually shows you a screenshot of the CCATT website. If you click on professional development that you'll see there when you go to the website, there'll be a drop-down menu, and then you can click on Data-Informed Governance. So what does data-informed governance look like in practice? Well, CCATT is finalizing, as Dr. Deaver said, learning module series to help boards build data capacity and competency while emphasizing strategic oversight with strong board and CEO partnerships. These self-guided modules are between 7 and 10 minutes each as they walk you through the 9 steps of data-informed governance. These videos can be watched by you individually or collectively in a board workshop or retreat, and there are discussion guides for each module and additional resources provided. So the next slide shows you the Data-Informed Governance, or DIG, framework, which is the basis for these modules. Notice I said data-informed. A lot of times you hear the word data-driven, and sometimes data-driven and data-informed are used interchangeably. Data-driven is really decisions based on numbers and primarily numbers alone. Data-informed is based on, yes, those numbers, but also qualitative data and human judgment. So not only what the data says, but why it matters. So the DIG framework is informed framework. It provides the steps of a dynamic process to guide strategic direction, to align data with your strategic plan, and to develop a culture of continuous improvement. The framework helps guide the use of data to guide transformation and impact improved student success. Throughout the modules on the next slide, you'll see that there's a case study of a fictional Bluebonnet Community College. This case study provides specific examples of each step in the DIG framework. Opportunities and challenges faced by the Bluebonnet Board are similar to the ones you are experiencing. So following their journey through the modules gains you practical skills. So let's dive right in. The introduction and modules 1 and 2 are currently on the website that I showed you, while the others are still being finalized. So we're not going to play the videos for you today, but you can go to the website and view them. In the following few minutes, I will highlight some key topics covered in the first 2 steps of the DIG framework. The information I've provided you so far is what is in the introductory module to give you an overview of the DIG framework. So Module 1. Module 1 focuses on defining clear objectives. What is a clear objective? What are the characteristics of that objective? What's your role in partnership with the CEO to develop the objectives? And are those objectives aligned to your college's strategic plan? We'll explore the challenge faced by Bluebonnet Community College. Like many of your colleges, the Bluebonnet Board is looking at post-completion student outcome data. They're wanting to expand some of their credentials of value. In particular, they are exploring healthcare programs. So the next slide looks at where they're starting with this process. There was a topic at the current board meeting of Bluebonnet Community College, and they asked the CEO, Dr. Martinez, to provide a high-level overview of all of the healthcare programs, as well as the last 3 years of student data and current labor market data. After the presentation by Dr. Martinez was completed, the board started into a discussion. They had about 10 minutes or so of somewhat disjointed, but a lot of brainstorming ideas that came along. And the board chair Chin of the board said, I really thank you for all those ideas, but I suggest that the board needs to develop a clear objective to guide the college and partner with the CEO to expand the number of completers in the healthcare programs needed in the community. And they agreed the objective had to be strategic. In other words, focusing on the outcomes and not on the implementation actions. And they needed to state specifically what they wanted to achieve. It had to be measurable. They have to benchmark where they are now so they can measure how they're improving and track the progress to that improvement. And finally, the board needed to set a clear timeline to create urgency for change and let the college as well as the CEO know their expectations for when they wanted to see this objective completed. The next slide, the board and CEO really clarified the difference between governance and operations with the concrete examples like you see on the slide. This question often comes up, particularly when training new board members. What's the difference between operations and governance? As trustees, you set the direction. You provide the outcome you want to see, in this case, increased completion rates. As a board, you do not set the route, the specific actions to get there, such as the hiring the 3 faculty. It's important to focus board conversations at the governance level, outcomes that you want to see happen, and empower the CEO to manage operational decisions, how to get to that outcome and achieve those goals that you're setting. So with the next slide, the Bluebonnet board was trying to finalize an objective. And they said, we need to ask ourselves 3 questions. First of all, does this objective support our strategic priorities? Is it related to our strategic plan? Does it address community needs? We talk about healthcare. Are there needs in the community for more healthcare professionals? And can we measure success? Think for a moment about your board and your objectives. And you see the discussion questions here. Does your board's current objectives meet the criteria of clear and effective, including the timeline, including the specificity? How well do your board's objectives align with your strategic plan? And think also, what role does the board play in objective setting? These discussion questions are from Module 1, and each of the modules has a similar set of discussion questions for you to think about and for you to discuss with your board regarding that specific step in the DIG framework. So as we move to the next slide, back to our Bluebonnet board, they answered yes to all of 3 of the questions, and so they adopted this new objective for their challenge. The objective is to increase the number of students who complete credentials of value in healthcare by 20% within 3 years. A clear objective with timelines and specificity. Now the board has set the objective, so now what? So Module 2 is the next step of what do we do now? What actions? What do we need? The next step is truly defining goals for data identification. You as board members know you need data. That's nothing new. And you know you need data to be effective. But that is different from knowing what data you need to make governance decisions about an objective. Needing any and all data can be overwhelming and can lead you down rabbit holes. Knowing what data you need keeps the board focused on the objective. Identifying what data you need can be best determined by deciding what are the strategic data questions we need answered that allow the board to establish baseline measures and monitor progress toward the objective. In Module 2, we also looked at, in the next slide, the differences between governance and operation on these strategic data questions. Bluebonnet College faced what many of your colleges also faced, and that was they wanted to improve math success. So they implemented math pathways. And the strategic question that they ask the administration to provide to them is, are the math pathway reforms implemented last year improving student success in gateway courses? They did not ask an operational question such as how many students are actually enrolled in college algebra. So a good example of strategic, the outcome, versus the operational, which is a step in how. So with that in mind, at the next step, the board decided that they have started with a very clear objective, increasing the number of students who complete a credential of value in healthcare by 20% within 3 years. Now they're ready to develop their strategic data questions. Now, these questions needed to focus on the strategic issue of improvement and not the how of day-to-day operations that the CEO will develop with the college team. They also need to have it answerable with available data and existing staff and technology capacity. And lastly, it had to be actionable. This data needs to be able to provide them insights that inform policy and resource decisions. So they asked Dr. Martinez about various types of data that are available at the college that can lead to insights that inform their policy and resource decisions. The next slide, Dr. Martinez assured them that they could get both quantitative as well as qualitative data so that they can have a data-informed strategic insights. With quantitative data, we're talking about things such as enrollment, persistence, completion, the numbers of the student story. How many, how much, how often? Qualitative data includes surveys, focus groups, interviews, and observations. Hearing the student and faculty voice in this situation. Both types of data are important, as the quantitative data tells us the numbers story about the students and their success. The surveys and focus groups with students, faculty, staff, maybe some people from local hospitals, medical professions, provide context and deeper understanding of why and how to improve the numbers. Putting these 2 types of data together, the numbers and the voices, provides greater insight for the board. Now, Bluebonnet Community College, as we see on the next slide, like all of you, looks at lagging indicators each year. They look at graduation rates, they look at transfer rates. And these numbers reflect student outcomes after they have occurred. This data is really important for policy revision, for state funding, for providing insights for the future. We also know that when we start a new strategy, it may take 2 to 3 years before the lagging indicators show improvement from that strategy. The students have to start in the program under the new strategy, and they have to complete it before we get the graduation or transfer or completion rates. So the Bluebonnet board wanted Dr. Martinez to report on data that could show progress toward the objective along the way and not wait for the 2 to 3 years. Dr. Martinez explained that leading indicators are predictive of future outcomes and also allow for adjustments along the way. Some ideas for the healthcare objective could include the number of credits students in the healthcare programs are earning in their first year credit accumulation. It could include course completion rates, those courses that they have to complete in order to continue. It could include persistence from 1 year to the next. So with that in mind, the board chair Chin said, let's look at some discussion questions. Let's look at some questions about the data we need to be asking. What are our strategic questions? We have the objective. What are the key questions we need to get the data to help us answer? How do we currently identify what data we request? And how can we ensure our data questions focus on governance rather than operational concerns? Again, these are questions you can ask yourself and of your board around in Module 2. So with those questions in mind, the Bluebonnet board came up with 3 strategic questions that we see here on the slide. This is for them to monitor the objective of increasing student completion in healthcare programs. So you notice the first question about current completion rates in healthcare programs. This one is a lagging indicator because it's a completion rate. And we want the last 3 years because we need to know this if we're going to be able to monitor an increase of 20% in the next 3 years. The second question, the one about first-year credit accumulation, is a leading indicator that can be monitored after the first year of implementation. Having the data for the last 3 years on this question will let the board see if the strategies developed by the college team this year are moving the numbers forward. It also will help the board determine if there are barriers at the governance level that they need to address after the first year of implementation. The last question explores differences in the data from the first 2 questions. For example, you might look at differences between healthcare programs, between nursing, between red tech, between pharmacy tech, other healthcare programs. Are there any disparities or differences in the data around completion rates or first-year credit accumulation? You might look at part-time and full-time students. Are there differences between completion rates and first-year credit accumulation for part-time and full-time students? And if you're seeing differences, then you need to say, why? Why are those differences having? So your qualitative data would come in once you look at your quantitative data. So these are the strategic questions that will be guiding the data gathering process that will come next. So based on these 3 questions, the board and CEO are now ready to move forward to the next steps in the DIG framework. As we go back to the slide that I showed you earlier on, this is the slide again of the website where you can go and get this information. As you scroll down on the website, you will come to the next slide here, which is the list of the remaining modules around the DIG steps in the DIG framework. We look forward to publishing the remaining modules later this year on each step of the DIG framework. We want to provide you with a resource about the framework to empower you and your board in partnership with your CEO for greater success for the students you serve and the communities in which you also serve. So thank you. I look forward to hearing about the continued work that you're doing at your institutions. Let me say thank you for your service to the community colleges. Your leadership and guidance is critical to the success of our students and the success of our communities in the state of Texas. Thank you for your work, and I will turn it back over to Dr. Deaver.
Thanks, Martha, for your presentation. Before we open the Q&A, I have a few closing announcements to share. Since the first 3 DIG modules went live in September, several colleges have already featured the materials during their local board meetings or workshops. We would like to recognize individual trustees and boards for engaging with this important content and celebrate your DIG champions when we gather for this year's CCATT conference, annual conference. Our website now has additional details and links to 2 different surveys that can be filled out for you or your board to be recognized for the 2026 DIG champions. This year's conference will be held in Baytown on September the 17th through the 19th. And the theme is Sustainable Success, Community College Governance, and Long-Term Impact. The CCATT Education Committee is putting together an action-oriented agenda, and we again have breakout sessions specifically designed for board liaisons. CCATT is hosting a luncheon on Thursday for those attending the conference for the first time. This will be a great opportunity to meet members of the CCATT board and learn more about the essential pillars of trusteeship. For those available to join us on Thursday afternoon, we will also offer several pre-conference sessions at no additional charge. These include a workshop on state and local advocacy strategies, a new trustee orientation, a special convening exclusively for college staff who serve as board liaisons, and hometown highlights with a tour of Lee College, where you will have the opportunity to visit both their main campus and the McNair Center with state-of-the-art labs and equipment for workforce development. As we have offered in recent years, the Chair's College Scholarship will provide 1 free trustee registration for each college. If the board chair is unable to attend, they may designate another trustee as their proxy who can use your college's unique promo code to register. There will be an in-person meeting of the Chair's Council at the conference on Friday, September the 18th at 2:15 p.m. Additionally, this year we are offering free registration to new community college CEOs. A strong board CEO relationship is paramount to your college's success, and we hope you and your CEOs will plan to attend the conference together. Finally, early bird pricing is available through June the 30th. So we encourage you and your team to register early to take advantage of the discounted rate. I look forward to seeing you in Baytown in September for the CCATT annual conference. Remember to fill out the online form so you or your college can be registered as a DIG champion. In the meantime, we encourage you to join us next month for the webinar on July 30th, featuring the state policy update from TAC President and CEO Ray Martinez, who will discuss recent rulemaking and interim legislative developments. On August the 27th, join us to learn from CCATT's senior consultant, Dr. Brenda Kays, about Article 1 of Senate Bill 37. It's important to understand new board level responsibilities related to each college's review of your general education curriculum and how to ensure compliance before the January 1, 2027 deadline. We so appreciate your time today, and we now conclude the recording. Nicole, have we received any questions from the audience?